Good morning. We are excited to kick off October. It's October already, which I can't believe that. But I'm Kerry Doman, founder of LittleGuide Detroit, joined today with our friends from Priority Health, and we are talking in our new series called Adulting. And this came about from our team being like, wow, not only there are days that I literally look at my children and I'm like, I'm the mom. I want to call my mom. I want someone, but like they're looking at me for the answers. And then there are just some things where not only in being the mom, but then being the adult, that we don't have all the answers. We don't fully understand. So this is our new series called Adulting, and we're going to tackle some interesting and sometimes hard to understand topics. First one on my list, and this was always number one, was health insurance, health coverage. And I turned to one of these ladies, Miranda. I turned to her from Priority Health, and I was like, help me out last year. As a small business owner, I have to search for my own health insurance for not only myself, my husband, my three kids. And it's a lot. It's a lot to navigate. It's a lot to understand, whether you're in a business and have coverage or you search for your own. Just understanding all the acronyms. Miranda had to help me with all the acronyms as well. And what we had last year in the coverage wasn't actually the best coverage for us. So walking through it all with the team from Priority Health helped me immensely. And so this is why it's near and dear to my heart to talk to them again in hopes that it can help you understand a little bit more about what coverage there is available, how to navigate it, what you're looking at, what you should be asking the experts, and how to go about it all. And so joining me within a formal introduction, Miranda and Omira from Priority Health. Thank you for joining us today.
Hi, good morning.
Good morning. Thank you for having us.
Of course. Honestly, I tell that story all the time because Miranda, and of course, I'm the one. Let's talk a little bit first and foremost. I know we'll get to it real fast, but the deadlines or the open enrollment's coming up. This is why this is a very timely conversation. The deadline then ends in January. And I think like literally it ends January 14th, 15th. And on January 14th, I was like, all right, Miranda, let's do this. And she was so gracious. So please don't be like me and wait till the last day. But that's why we're talking about this now, because open enrollment is coming up. We will get to those important dates. But first and foremost, can you tell us a little bit about Priority Health, who you are? You're Michigan based. Tell us where you're at and a little bit about Priority Health.
Yeah, of course. Priority Health is a nationally recognized nonprofit Michigan-based health plan. However, we're not just a health plan, we're also your friends and your neighbors too. Our main office is located right here in the heart of West Michigan. You may be familiar with some of our hospitals that are in network, such as Corewell Health East, formerly known as Beaumont. We have Trinity Health East, Henry Ford, University of Michigan, and there are many others as well. Those of you also on the east side, you may have noticed 9 free outdoor fitness courts that we have sponsored throughout the Metro Detroit area. Our newest court on the east side of the state is in Lincoln Park. We also have fitness courts in Belle Isle, Hamtramck, Madison Heights, Marysville, Highland Park, Redford, River Rouge, and Oakland University. So there's several.
I love it. And I'm going to call you out real fast. She's from the West Side. So Hamtramck is
Hamtramck. Thank you.
But Kerry from our team, she was just at I believe the Lincoln Park location. And it was very cool. We put it on our Instagram story. So yeah, I think that's one of the coolest things is when you can see companies like Priority Health actually giving back and in the community. I know this last week or 2 weekends ago, we were talking a lot about the diaper drive that you guys did.
Yeah.
So I love that you're so involved in the community, giving back to those that are, again, in the Michigan area. So I know I previously just said that I am an individual, like I have to have an individual health plan. Some obviously get it through their work. Can you talk a little bit about the individual health plan, what it is,
Yeah.
who qualifies for it, et cetera?
Of course, an individual health plan is for anyone under 65. So people who can obtain health plan from an employer, Medicaid, Medicare. So this means if you're an entrepreneur, a freelancer, or between jobs, or someone who's just looking to retire early, you simply are not offered health insurance by an employer, then this plan is for you. And some may also refer to an individual health plan as private health insurance.
Love it. Yep. That's where we're at. Okay, and we talked, I alluded to the end date of January 15th, but talk a little bit about enrollment, why this matters. I know this changed a couple years ago, but what the enrollment period is and why it's so critical to do your research now in preparation, because when it ends, unless it's a life event, which we can talk about as well, it ends.
Yeah, it's really important to know when the deadline for 2025 enrollment is. The deadline to enroll for a 2025 health coverage is January 15th. However, there are only two time frames where you can enroll in a health plan. One is during the open enrollment period, and the other is during a special enrollment period. Open enrollment period is literally right around the corner. We're gearing up for it now. Calls are coming in. And so that begins November 1st through January 15th.
Yep, and it's also important to know that there are two types of enrollment periods, or two type of open enrollment. So the first half of open enrollment is November 1st, or sorry, so the first half ends on December 15th for a January 1st effective date.
Right.
And then the second half of open enrollment is December 16th through January 15th. And that is for an effective date of February 1st. Now, outside of open enrollment, you would have to qualify for a special enrollment period to enroll in a plan. So our Michigan-based health insurance agents are here to help.
Yeah. Okay. So I know life gets busy and we all push things down the road here, but so what happens if you do miss that January 15th enrollment date?
So you may qualify for a special enrollment period. A special enrollment period is a 60-day window that does allow you to enroll in a health plan anytime throughout the year. However, you may have a qualifying life event and you may be eligible for a special enrollment period.
Yeah, I just want to mention a few of those qualifying life
Yeah.
events. The most common one is losing your existing coverage. So that could be with an employer, it could be Medicaid because you moved. It could also be because you turned 26 and now you're no longer eligible to be on your parents' plan. So it could also be that you're expecting the birth of a new baby, you're adopting, moving to a different coverage area. There's just so many things that could qualify you for a special enrollment period outside of open enrollment.
Yeah, I think that's important to remember and realize. And again, to us, I feel like it's just so prevalent because we talk to so many families and moms, and maybe just because I've been pregnant for the last, 8 years, that pregnancy and the birth of a child it definitely qualifies. So good to keep that in the back of your mind. I mean, what happens if you don't? Is it even worth not having coverage? I can answer this for you, but I'll let you answer it. No.
Yeah, of course, here at Priority Health, we'd say absolutely no, don't go without coverage. We get that question often, but no, it's just not worth it. Without coverage, you could face significant financial burdens if an unexpected medical emergency does arise. Healthcare these days, it is extremely high. One day alone in the hospital could cost you up to $10,000. So anything can happen at any given time. And as we like to say over here, it's better to be with than to be without.
It's also important to know that regular checkups, preventative care, which are covered by My Priority Health plans, do play a crucial role in maintaining our overall healthcare coverage. So it helps catching potential early on issues. And also health coverage does provide you a peace of mind. It ensures you that you have access to the necessary medical needs and services without the fear of overwhelming expenses. And it does protect you and your family's well-being.
Yeah. And those preventative care appointments are so critical, especially as a woman. And I'm going to age myself here. I just had, yes, my annual OB appointment a couple weeks ago, but I also had my annual mammogram because I'm of that age and they are covered. I have, obviously I should have led with, I have priority health coverage, and knowing that those are covered, but also these kids go, they have their annuals. And if your child is of a certain age in the, baby stage, those checkups are regular. And if without coverage, I mean, you're paying for every one of those. Whereas with the right coverage, those preventative cares, the 3 months, 6 months, you feel like you go every couple months with the babies. Those are all covered and which is critical for not only the care of your child and yourself, but for the coverage as well. So, we'll just say the medical, it all adds up. It can add up, but where are some areas or ways, how are some ways that people can make it affordable, that can make health coverage affordable?
It's a really good question. So there's several ways that a shopper can save on their healthcare coverage. They can save by seeing if they're eligible for a subsidy, and if shoppers are not eligible, they can still save by shopping directly through Priority Health off Marketplace and choose a silver plan.
Silver plan. Okay, we hear subsidies, but that's like one of those keywords that you're like, what does that mean? That sounds like a very nice technical jargon, but you're like, what does that mean? What is a subsidy? And how do I know if I qualify? Like, how do I research qualifications?
Yeah, definitely one of the specialists here. We can help you. There's two types of subsidies when you're talking about them. So first is the advanced premium tax credit. This is financial help offered to you by the government to help lower the cost of your health plan premium each month and potentially lower your out-of-pocket costs. Give you some statistics really quick. 4 out of 5 families in Michigan will qualify for a health plan with a premium of $10 or less, depending on their annual income. A family of 4 can have an income of upwards of $124,800 and still qualify for that financial assistance. The second type of subsidy, it's called cost share reduction. This is just an additional benefit that one can qualify for via the marketplace that only applies to silver tiered plans. So something to keep in mind, cost share reduction, silver tiered plans, two of those kind of go together. This benefit helps to reduce the current deductible and max out of pocket on those plans, but potentially also your copays and coinsurance on a silver tiered plan.
What's a silver tier plan?
Yeah, so
We're
through the
gonna break
marketplace.
these things down. I'm just gonna ask the questions when it's
Yeah.
like, we talk like I should know this, but I don't. What's a silver tiered plan?
Yes, whenever you're shopping through the marketplace with a plan that follows the Affordable Care Act, they are in metal tiers, as we call them. So
Okay. No,
bronze, silver, gold plans.
I have noticed that. Okay. Didn't
Yeah.
know it was a thing. Okay.
Yes, as if you want to think of it as bronze plans have the higher deductibles, and as your deductible goes down, that's when your metal tiers start to change.
Yeah.
Okay. Any plans that can help save on coverage?
That is going to be the silver tiered plans, because if you're eligible for that cost share reduction, silver tiered plans have the most coverage ahead of deductible most of the time, and kind of a deductible that falls in the middle. People can get really nervous with having that high deductible, and premiums get higher when you have a really low deductible. So silver tiered plans fall in the middle of there. So it's a sweet spot where people are happy. It's not too high of a premium. It's not the lowest premium, but it gives that middle ground of a deductible.
Give them that cushion in between.
We like cushions. Cushions are good.
Yeah. Yes.
Miranda, something you and I discussed when we were talking last year about what works best for my family. And you brought up a narrow network narrow network plan. Can you talk a little bit about that, what that means, and basically explain a narrow network and how it can apply to like a family like mine?
Yeah, so narrow network plans, they do help our members save on the monthly premium by offering a smaller network of providers that they essentially have access to. This network includes groups of doctors, hospitals, labs, and outpatient facilities that have dedicated essentially to providing care to their community at a lower cost through these narrow networks with Priority Health. While receiving care within this set health system, you still do enjoy all the regular benefits of traditional coverage.
For example, like in the Detroit area, we have our Southeast Michigan Network Plan, which covers Corewell Health, East, formerly known as Beaumont, and Trinity East providers and hospitals, which Trinity was like the St. Mary, St. Mercy, IHA locations and providers.
And then correct me if I'm wrong, but then Miranda, we looked at that. You offered that as an option. And so when talking to an expert, just call them and let them walk you through this because it's so very confusing. You then looked at, I said, here's my pediatrician, here's our doctor, here's the hospital of choice that we go to. You then looked at all of that and said, yes, you would fit into this, or no, you wouldn't, right?
Correct. Yep. Any of our enrollment specialists can, and also prospective members or current members, you can go to priorityhealth.com, scroll all the way to the bottom of our homepage. You'll see a hyperlink that says find a doctor. You don't have to log in or anything to use that. So it's a good pre-shopping tool, if you will, for prospective members to use. But yes, us specialists here as well, we can look up your doctors to make sure and see if they fit into one of these narrow networks to help you save on your monthly premium.
I like the hand-holding process that you
Yeah.
I'm not gonna lie. Sometimes if I'm looking for now, I'm a little bit more self-sufficient, but man, it was just so crucial to have you in my back pocket to ask all these questions. Which leads me to the next question, which she was gracious not to laugh at me, but last year in my coverage, I had an HSA, and she's like, well, are you saving with that? I was like, I'm not sure what you're talking about. She's like, well, you have an HSA. And so explain to everyone what the acronym HSA means. I just, in my past coverage, it was a little cheaper, but it still covered some things, but I wasn't fully taking advantage of it. So it didn't make sense moving forward. Ultimately, it actually was not the right choice for my family and I. Again, another reason to call the experts and have them walk you through it. So, so explain a little bit about an HSA and how that could be valuable or not if you don't plan to utilize it.
Yeah, that's another great question. So HSA initially stands for Health Savings Account. And where it can benefit you is that the savings account is linked to health plans to help pay for healthcare coverage, cost, tax-free. So Priority Health does offer HSA. We do offer now HSA travel plans. We have specific plans designed for families who do want a lower deductible and also want to receive help, from the tax advantage from an HSA. But generally an HSA plan, it really does help those who do want to set money aside, for health expenses without having to pay anything extra on it. So it's definitely, it could be beneficial for those who do have that set aside, that health savings account set aside.
Yeah. But when you don't,
Right, exactly. And another thing is
that
that
is not worthwhile.
right, exactly. And Priority Health does make it easy to set that up. So if a member did want to go the HSA route, we have partnered with Health Equity, and they do offer free services for our members who decide to enroll with them or set up that health savings account with them.
Nice. All right, I know we've mentioned extra benefits, but and I know you guys offer some amazing additional benefits. Can you run through some of those?
Yeah, that list is growing, and we're very proud of our added value benefits. So here at Priority Health, we do offer what we like to call our added value benefits. These benefits can be viewed when members join Priority Health and log into their member portal. One of the added value benefits, access to care. That's probably the highest on the priority list with that is access to care. Virtual care is included for a $0 copay. So you're paying $0 for virtual care, urgent care options. We have on-demand mental health support as well. That is a wonderful tool. We have our member portal, of course, our Find a Doctor tool that I've already mentioned. You can be logged into your member portal, but also if you're a prospective member, please feel free to access that tool. So you can find preferred healthcare providers that are in your network.
Yep. And then there's also many ways to save and keep those costs down. So kind of going back a little bit to the Find a Doctor tool, if a member, is a member, what's nice about going into their Priority Health member portal is that it will only find providers that do accept their insurance. So that gives members a peace of mind knowing that when they log in, they're looking for a doctor, it's tailored to their plan. Now, ways to keep costs down, we have the cost estimator tool, where members can shop, procedures or even prescriptions to kind of see what their out-of-pocket's going to be for those. We also offer low prescription copays, discounts on hearing exams and the actual aids. Pediatric vision is covered under our medical policies for dependents under the age of 19, so parents don't have to worry about buying additional vision coverage for their children. And then we also have partnered with Price My Med, which is it helps members save by automatically applying a discount so that they pay a lower prescription price if one is available. Now, Price My Med evaluates every prescription in real time for discounts. We also offer many ways to save and be healthy. One is with global emergency assistance. So if you are traveling outside of the United States and you need assistance for medical, they do help with that. We have our well-being hub, our benefit hub, and also access to what we call active and fit gym membership at a low monthly rate.
Nice. I did not
A lot.
realize that you could do the cost estimator like that, like a mammogram, as I mentioned before, like might cost different at different places. Had no clue about that. So the fact that you can look that up and be like, oh, maybe decide of like what's in my area, what's in my plan, but is it going to cost? I just didn't realize that some of these things cost different. Like it's a mammogram. You'd think a mammogram here is a mammogram there, and it is not. So I think that's really helpful. What if you had a chronic condition?
Yeah, we know that that's an important topic for a lot of people these days. Recently, reports state that actually 60% of Michiganders are living with a chronic condition, pretty high number. Priority Health is committed to reducing that number, though. So all Priority Health members have access to coverage before deductible, meaning the deductible does not apply for a variety of medications and services to help keep their chronic condition under control more affordably, in a sense, right? For instance, our chronic condition management program, you'll find things like diabetes, high blood pressure, heart disease, asthma, depression, and anxiety listed there.
Quick question personally. Okay, so I have Priority Health. We set it up last year. Should I be calling you again during open enrollment to see if that's still the best plan for us? Should I update it, or should I just assume what I had last year will be the best plan for this coming year?
Yeah, it's always a good thing to call. It's always a good thing to, look over the plans, because with each year, with any insurance company, things change. So premiums may change, the deductibles, co-payments of, different plan types may change. So it is very beneficial that, you give us a call, you may stay on the same plan, but at least to see what those options are for you. Also, if anything has changed in
Oh, did we lose you? Cut out. But I will say this, that I will have a standing January 14th date with Miranda each and every year to check my current standing with Priority Health and plan and make sure that that I am set to go for the next one. And I can just say, you know, with my why I chose Priority Health, a lot of it has been answered here. But first and foremost, the customer experience has been phenomenal. I've had to shop for my own health insurance for the last several years, and I had never had the experience that I had with the Priority Health customer experience team. They legit walked me entirely through, which again, there are a lot of these questions and more that we have. I encourage you, if you have your own questions, to submit them. We will get them answered for you. But it's hard to navigate this stuff and understand what it is that you're getting and, you know, preparing for in the year to come. It's hard to know what's coming down the pipeline with health, and you just want to make sure that in the worst of circumstances you have the best in your back pocket. And I know that if anything were to happen, I can call Priority Health. They're a Michigan-based company. I'm going to talk to someone that is local. They are going to stay on the phone as long as they need to help me answer the questions that I have and get me the best care. So my hat's off to the Priority Health team. I am forever just grateful to have you as a partner here at LittleGuide to help us all navigate through this, but as a true partner in my household, because that's who I rely on. Again, I have 3 little ones that we all know. We went to the doctor's last week. I thought, I was convinced my son had pink eye. In fact, it was just allergies coming out of all eye sockets and noses and everything. Just knowing that I have the right coverage to support those when it's serious, or when you just are like, oh, we just need a little Zyrtec today. So highly recommend that you check it out. Also want to give a mention to Priority Mom and Priority Baby. They have some programs that are specific to us. They're designed to help moms during their pregnancies, to help reduce the cost of maternal care, the number of preterm births, along with NICU stays. We had a NICU stay with us. But then again, Priority Baby too, to help support the children once they are here, and the caregivers throughout the child's first 2 years. So I think we have them back. I'm going to get them back in, and they can help us close this out with telling us how to enroll and get signed on. To me, I know that the process can take as little as 15 minutes. You can do it all online. I am the type that likes to talk this through, to ask all the questions. As I mentioned earlier, yes, I can find a doctor on their website, but I can also make a phone call and they'll help walk me through it. So, oh, I'm so glad you guys are back. We have talked through a few things, but we are closing it out with this. How can we enroll? I know we talked about the timelines, the importance of being within those timelines, but can we close out with how to enroll, best ways to do so? Can they call now, get those questions answered so that they are ready to go in enrollment answers? Help us.
Yeah, of course. The process is easy, and it can really only take 15, 20 minutes, maybe. There are a couple of ways that you can apply for individual coverage. You can call us directly. That's, everybody wants to talk to somebody. I don't want to do it over a chat and emails. It's just, I need to get the full details. So you can definitely call directly and speak with one of our experienced enrollment specialists. That toll-free number is 844-801-4717. I'll repeat it one more time, 844-801-4717. Very important number. Our team of enrollment specialists will walk you right through the process and help you find the lowest cost plan possible that fits your needs. It's a seamless process, really. I know it can be stressful, but it can be seamless. So you can also go directly to our website as well, priorityhealth.com, and search through individual plans.
Nice. All right, we're at the end of the conversation, but is there anything else that folks should know about Priority Health, open enrollment, why to enroll with Priority Health? I sang your praises while you guys were had technical difficulties, but anything closing remarks that we need to know?
Yes, definitely. We both are very proud to work for Priority Health. Our mission as a company is to improve health, instill humanity, and inspire hope. You can feel that when you are working with one of us. I know myself, and I'm sure Miranda included, would recommend Priority Health to our parents, grandparents, friends, family, honestly, anybody, because I know for a fact they'll be treated well here.
Yeah. And that's why it's such a great partnership for us, because I know that too. And that's what I said earlier. It is such you make it a very easy process. And Miranda, you missed it, but I said we have a standing date every year on January 14th. I'll be calling you. Maybe I'll try earlier. But you guys, I'm so grateful for all the help that you continue to give not only the LittleGuide community, but my family personally. I really, truly appreciate it. And thank you. Thank you for the insight today. We will have all of this information and more on littleguidedetroit.com. Obviously, watch this, rewatch it, but most importantly, reach out to Priority Health. Don't miss the dates. Call that number, check online. But even if you have coverage, make sure you're in the right coverage. Like I said, I had coverage with another company that was completely not the right one that on paper I thought I was covered. And thankfully we had a fine year, but it's just when things don't go as planned, that you learn real quickly if you're covered or not. And so I'd rather know that on the front end. And that's why, Miranda, you have a customer for life. Don't go anywhere, because you got a customer for life. They'll take care of you. So thanks for joining. Thanks for tuning in. Thank you, ladies, for your expertise.
Thank you,
We are
Kerry.
so grateful. And yeah, we'll see you. We'll be back here in January to poke everyone again to make sure they're not like me and waiting to the last minute. But if you are like me, we'll be back here in January having another conversation with these ladies and getting that last minute content we need to get us signed up and ready for 2025.
Yeah, we're excited.
We are.
Thanks. Have a good day. Thank you.
You
Thank you.
too.